Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon, and we are back with Kelly Herbert, the CEO of our practice. Today, we're going to be talking social media and how it's really changed the facial plastic surgery and plastic surgery world.
Yeah, thanks for having me back. So I'm going to jump right in and ask a few questions. So first, how do you think things like Instagram and TikTok, people showing their personal journeys or maybe their before and after photos has changed patient research and then what they're asking you for in a consultation?
Yeah, so I'd say first and foremost, it's definitely gotten the message about our industry out there to the world. And I think made people a lot more aware of the actual types of surgeries that we're doing. Because, before I think that people just assumed a facelift was kind of like you came in and you had everything with your face change. And so now people are really knowing what these terms mean. They come in with a little bit more education, and they're seeing before and afters. Whereas in previous years, even before websites, there was really no way to see the before and after transformations of real people other than celebrities that were talking about it or that people knew about it. So there's definitely a lot more knowledge out there. It certainly is changing what people want because I think that they're seeing certain photos that may or may not be real, and they're asking for those particular results for them, which may or may not, again, be a good fit for that individual.
Yeah, that makes a lot of sense. I also think it's removed a lot of the taboo around plastic surgery, right? So it
Yes.
used to be very hush hush if somebody did have a facelift or had some sort of cosmetic surgery they hid out in their house and didn't want anyone to know and they would never admit it. And now people almost wear it like a badge of honor, right? Which I love because it's empowering people to let their insides match their outsides, right? And so you're able to help them achieve that on the outside. The dangerous part, I think, is when we over filter our pictures on social media for that after effect. You've already had a great result, but you're looking for those extra clicks. So you add a special beauty filter, and that's what patients are bringing in.
Right.
What is the biggest myth that you've had to bust from social media when someone comes in looking to achieve a particular outcome?
Yeah, I mean, so again, I think that one of the biggest myths is that a particular result is going to be the right result for them. Because especially with what I do in facial plastic surgery, every single result has to be tailored and customized to that individual so that it fits them, it looks like it belongs on their face, it's natural. And so I think oftentimes it's easy to misunderstand that even though that particular person, male or female, looks beautiful in that after result, it still might not be the best sort of approach for them.
So, how do you talk to a patient whose expectations have been shaped by social media? And what happens if you guys disagree on what the plan forward should be?
Yeah, so I mean, first of all, I always welcome photos because it gives me a little bit more, it gives me more data points so I can kind of get a sense for what they're looking to achieve in a broad sense, not that exact result. So I do welcome photos, but I always ask them to hold off on showing their photos until we're actually done going through our entire consultation process. Because quite honestly, when we get to that point of the conversation, a lot of times those photos that they were going to show me and bring in and say this is what they want, they kind of become irrelevant. And I think that they've now been educated to the fact that, again, we're not shooting for a particular photo result. When we go through their individual photos, so their real photos, and we're truly dissecting and being analytical about what we're seeing together and what I'm seeing, and we're truly looking at measurements and doing an exam of their face and so forth, and we've gone through all of that, a lot of times those photos just go out the window, right? And they say,
that
you know
makes
what,
sense.
I don't even think I need to show these photos anymore because they agree with that plan that we came up with together.
Have you had an experience where someone's been down the social media rabbit hole and you've had to say, I don't think you're a good candidate for me as a surgeon and you as a patient just because of your expectations being misshaped by social media? Have you had that happen?
Yeah, absolutely. I mean, the minute a surgeon gets a sense that they can't deliver what the patient is looking for, is the minute that the surgeon has an obligation to say, hey, I'm just not the right fit for you. And it doesn't mean that there might not be a surgeon out there that is a better fit, but that fit for both patient and physician is so important because these are long journeys. It's not just you come in, you get your surgery, and then we never see each other again. I'm seeing you for 6 months, 12 months, et cetera. And so we need to have that connection and make sure we're on the same page for both of us to be happy in the end.
Great. Okay. I've got one last question. It might be a bit controversial, but tell me your thoughts on other facial plastic surgeons sharing information on social media. Do you think it's a good thing that you guys are out here sharing this information? And what type of information is right for people to share?
Yeah, so I personally love educational videos. That's why we try to do them. I think there's also a lot of other prominent surgeons out there that are doing great educational videos. I love it when surgeons are showing the true transformation early on, and so showing the good, the bad, and the ugly. Meaning that patients have the ability to communicate. This is actually how I felt after surgery. Because I think a lot of times, at least in years past, we were only highlighting the end result, the good, and not really the journey. And so it's nice to hear from patients, hey, this is how much pain I had. I didn't get much sleep those first couple nights. These were the side effects that I experienced. I think that really helps to educate patients. What I don't necessarily like, which I think is a growing trend recently, unfortunately, is other surgeons that are commenting poorly on other surgeons' work, and especially celebrity work because everyone knows about it. Because quite honestly, those surgeons were not there. They have no idea what took place during the consultation process in terms of what the patient wanted, whether it was a good fit for that individual surgeon. And they certainly don't know what happened during surgery, and they're just making guesses. And I think that oftentimes they're attacking other surgeons and the end result with very limited knowledge. And it's really probably just to get clicks and get attention onto their page.
Well, I'm grateful to work alongside of a surgeon like you who doesn't need to do that to get clicks, and you're here to educate the patients out there. If you liked what you heard today, Dr. Ladner would love to see you for a consultation. Please do give our office a call.